This episode of The Construction Record is brought to you by the Ontario Sewer and Water Main Construction Association. Clean water is everybody's business.
Hello, everyone, and welcome to episode 79 of the Construction Record podcast. This is Vince Versace, National Managing Editor of the Daily Commercial News and Journal of Commerce, joining you today. My, how the world has changed, listeners of the Construction Record podcast, since we last cut an episode for you and published it. The world is in the throes and in the grips of the COVID-19 pandemic right now. Not that it wasn't 2 weeks ago, but 2 weeks ago was a different story. We were still looking at how Italy had been brought to its knees thanks to COVID-19. We were still hearing about how it had picked up in Iran. And we were still getting dispatches from South Korea and China about how the situation was slowly starting to improve there. But then the pandemic became a real thing for a lot of us here in North America as it made its way here and testing started to increase. And I'm not telling you something you haven't heard or read or seen over the last few days here in Canada or the US. So I'm not going to pretend to be the one conduit for you for COVID-19 information. But what I can tell you is how our news team and how our podcast team is going to tackle this global story, which is impacting every sector, every community, everyone that you know, every business that you know. And we see it as our responsibility at the DCN and JOC and with the Construction Record podcast to tell you the stories of how this industry is dealing with this pandemic, how it's mobilizing itself, not just to protect its own workers, but in some instances, how it's mobilizing itself to help their local community that maybe some construction associations or construction companies find themselves in. We're already hearing early stories right now about construction appeals being made to certain construction associations. For them these appeals are coming from hospitals and health care units, asking people in construction, hey, do you have extra PPEs, extra masks that you could donate to us? We're starting to hear some of those stories. We're starting to track some of those leads down, but there's an example of healthcare reaching out to construction for assistance because the worst is still yet to come here in North America, in Canada and in the US. The worst is still yet to come because the testing on the US side is now starting to slowly gain some momentum. And in Canada, we've been testing, probably still not enough, but been trying to be ahead of the curve to flatten the curve, as you've heard. And we find that an intriguing piece. You know what I mean? Two different sectors coming together to help each other out. And really, in the end, that's what this is all about. You guys hear about it. You don't need me to preach to you. Besides taking care of your own personal hygiene, social distancing makes sense at this point. Reducing the ability of the transmission of this virus is incumbent on all of us. You don't need me to preach. I've said that again. But I'm a big proponent of the social contract theory. And we need to take care of each other. We need to take care of our own communities. We need to look out for each other. And the interesting thing in that is that to look out for each other and take care of each other, one of the best things is to stay away from each other. Take it seriously, folks. This pandemic is not a joke. If you're still on the fence and you're in construction about what to do on a personal note, I think the answer is pretty clear. Right now, we got to do everything we can to not spread the virus. Take care of your own personal hygiene and self-practices. Now, when it comes to the area of business, those are the stories we're covering too. You know, we have an interesting debate here in Ontario where we have some stakeholders in Ontario construction saying business has to keep running as usual. It has to be as usual. These sites have to stay open. Grinding things to a halt does no one any good. Then you have other stakeholders in Ontario construction saying, yeah, we need to use a sledgehammer to stop this thing. And if that means slowing down our work sites for a short term, it's worth it for the long-term benefit. Now, we've seen that discussion kind of percolating here in Ontario. Conversely, in BC, we were able to get some clarification from the provincial health officer and ministry there. There had been an order placed prohibiting mass gatherings of 50 people or more in British Columbia. Russell Hickson, our staff writer there, was able to dig in and get some answers from the province. And we were able to just get confirmation just recently that job sites are not mass gatherings, according to BC officials. So construction job sites can keep open. But the health officer and the healthcare proponents and stakeholders in BC are saying this, still saying the same thing that you hear as a general message to the general public. Practice best practices around hygiene and keeping yourselves clean and not presenting opportunities for transmission. It's interesting how we've seen BC mobilize. One of the other stories we were able to track down really in the early days as well is around the cabinet being created, a business cabinet. BC construction groups have helped found the COVID-19 business cabinet. We just have this on our website, published today on Friday, March 19th. And it's basically the BC business community has announced the creation of a COVID-19 cabinet to address significant impacts on that province's economy. The cabinet includes representatives from the construction community, like the Independent Business and Contractors Association, the BC Construction Association, the BC Road Builders and Heavy Construction Association, and the Construction Labor Relations Association of BC. So that's kind of a fascinating kind of development. In really a short amount of time, we've seen that. Our coverage to date, whether it's been on the national level or regionally in BC and in Ontario and across the province, we've been trying to report as much news as we can about the impacts of COVID-19 on construction. What we're seeing is a mobilization. The industry's taking this seriously. You see the health and safety proponents in construction starting to lay out what they think should be done. In some instances, there's a interesting debate on the BC side of things, as far as work sites, need to be like something like Site C has been scaled down for worker safety. Sorry, as I trip over my words. Site C was scaled down for worker safety. Very interesting, massive project, taking it seriously. We're talking about hundreds of workers in these work camps and sites that are in close quarters that need to all of a sudden start practicing some, COVID-19 prevention practices, some transmission blocking practices. So they're scaling down the type of work to help reduce kind of that interaction, which is interesting. Basically, we've had a couple of health and safety stakeholders in both BC and Ontario say the one thing. We have to figure out what is essential as far as work when it comes to construction. Building a hospital, helping maintain a nuclear power plant, that's essential, we're hearing from people in the industry. But trying to complete a commercial building or a 3-story walk-up, probably not an essential project, essential work that needs to be done, which could potentially put workers at danger. Interesting debate. Obviously, the industry and the healthcare OH&S associations and practitioners of construction are all going to take their lead from provincial healthcare, from the provincial officers that have become our lifeline into what we need to do as a community, as a sector, when it comes to fighting COVID-19. So we endeavor, our team, to present to you all the news that we can as quickly as we can. Our website's pretty fluid most of the time. It's really fluid right now with updates. Follow us on social media. Follow dcnonl.com or joconl.com, our two websites, for updates, for pertinent updates, whether it's from the national end of things about how potential border crossing limitations, though not applicable to commercial and trade right now between the U.S. and Canada, but how that could be potentially impacting supply chains in construction. That's something we're looking at. Obviously, we're looking at the question of, do we close sites? Yes or no? What needs to be done? And we're reacting to announcements pretty much daily right now. And we're trying to share the news with you about construction events that are being postponed and canceled as well. We're trying to stay on top of a lot of those announcements and sharing them with you. An interesting thing that we started to look at just about a week ago is we started to look back at the Spanish flu, the Spanish influenza. of 1918, 1919. And to see what were the lessons learned and the impacts on construction and the workforce back then when that pandemic ravaged the globe over 100 years ago. So we're starting to create those stories, collect them. We published one about how the Spanish flu impacted BC. I have a couple in hand now that just need to be edited that are going to be published. One in particular around the Spanish flu in Toronto, and another story about how the federal government of Canada at that time, some of their decisions and obstacles and issues they ran into in dealing with the Spanish flu. So keep an eye out for those stories. They're going to be coming out on the DCN and JOC websites in the next couple of days. As well, we've taken some interesting look at things like force majeure when it comes to contracts and COVID-19. If you want to get some intel around that, visit our websites. We have stories about that, and we're attending another teleconference on that. So we have Russell Hickson, who's going to speak to you just shortly. He has some musings about some of the stuff he's working on that concern COVID-19 and possibly the Spanish flu as well. So with that, stay well, stay safe, stay away from each other, but also look out for each other at the same time. It's unprecedented times right now for all of us. So let's be smart, let's be vigilant, let's be prudent. With that, I throw to Russ. Take care, listeners and readers, and we'll talk to you soon again. Thank you.
This episode of The Construction Record is brought to you by the Greater Toronto Sewer and Water Main Contractors Association. Clean water, our goal, our future.
Hi everyone, this is Russell Hickson, a Journal of Commerce reporter, and well, let's get right into it. There's just a lot of news that's happening, especially in the construction industry, as it responds to the COVID-19 crisis. So yeah, a lot of things are changing. We've seen several major projects wind down and kind of adjust their operations. First, you saw Kitimat LNG start to scale back, as well as Muskrat Falls in Newfoundland and Labrador, and I'm sure some others. Then after some pressure from the unions to call for Site C to wind down its operations, it has done so as well. They're going to keep doing some essential work on these sites, specifically for Site C. They're going to keep the site secure. They're going to try and keep meeting the project's environmental commitments, and they're hoping to achieve their river diversion in the fall still. Let's see here. What else? Yeah. The Vancouver Regional Construction Association had some concerns earlier this week about mass gatherings, as the province's health officer instructed meetings of 50 people or larger to be banned. And that caused some concern in the construction industry if that applied to job sites. And it looks like we've got some clarification on that. The VRCA found that the job sites qualify as industrial sites, so that does not apply to them. However, the Ministry of Health did advise to try and reduce the number of people on these sites. And if you are on these sites, you're supposed to practice social distancing by maintaining at least 2 meters of separation. And they're strongly discouraging congregating in break areas and lunchrooms. And shortly before all this accelerated quite rapidly, I did kind of do a look back at the last influenza that swept through Canada and BC and Vancouver with a piece on the Spanish flu. And that happened in 1918 and 1919. And it killed about 50,000 people in Canada and about 4,000 people in BC. About a quarter of those were in Vancouver. And based on the research that I looked into, in today's numbers, that would be about 37,000 deaths for BC and 5,000 for Vancouver if you adjusted it. And I kind of combed through a bunch of historic newspapers. I was hoping to get a feel for what people were talking about at the time in relation to construction and what they were writing about and what their concerns were about. And it was pretty interesting. I saw a bunch of articles about how it was impacting shipbuilding. That was a big thing in Vancouver. Several massive shipyards had these major steamers and warships delayed because their superintendent was dying from the flu, their workers were sick, they couldn't come to the job site, and so that was a major issue. And another thing that started to happen as I read through these papers, the city of Vancouver became kind of a hub for sick people as the interior people started to kind of go towards the city to get treatment, and they were all of a sudden responsible to care for all these people, and emergency facilities had to be built, and that kind of went to the construction industry. They had to build an emergency hospital in about 30 days for about $30,000, and it was near Vancouver General Hospital. And they succeeded. It wasn't without some controversy, though. Looks like day labor was used, and the British Columbia Record wrote that the fact that no local architect was called upon to prepare the plans, or no local contractors were asked to bid on the construction, it got a lot of criticism. And I also this week turned my attention to Alberta, and I'll be writing about this probably later this week. Kind of as projects, major projects like Site C and Kitimat LNG try and scale back their construction efforts. We saw the Alberta Construction Association with a bunch of other groups send a letter to the Premier just strongly urging them to keep the construction industry working. They don't want their sites to shut down. They don't want their sites to go away. And it looks like they're working on a version of best practices developed in collaboration with industry leaders. They say that this living document will be widely disseminated to encourage safe operations. So they're confident that they can keep their job sites humming along as the crisis continues. And so that's kind of what I've been working on this week, and a lot is developing, and I'm sure as you're listening to this, a lot is going to have changed. So at the Journal of Commerce and the Daily Commercial News, we're doing our best to stay updated on what's happening. And I think that's all for this week. Thanks, guys.